Assalamualaikum. So CSA scenarios for TMRCGP. So how to pass the CSA full marks in 10 minutes. Each case is marked using 3 equally weighted domains like data gathering, management and interpersonal skills. The key is to complete all of the above domains for all cases competently within the allocated 10 minutes, and here are the 5 key steps needed to do this. Number 1, initial open question, and number 2, targeted history with red flags and examination if needed. Number 3, ideas, concerns and expectations, eyes, and effect on day-to-day life. Number 4, explain diagnosis and shared management plan. Number 5, safety net or arrange follow-up. Keeping to this basic structure will ensure all domains are covered. The red flags and safety net ensure the consultation is safe. Many candidates swap step 2 and 3 around, so ICE is asked earlier on, and this can often be a good way of electing a patient-centered history. All 5 steps pose a challenge to the CSA candidate, but most find step 2 and 4 especially difficult, like targeted history with red flags and examination. Okay, and 4, explain diagnosis and shared management plan. Therefore, while this book covers all 5 steps, it goes into more detail on step 2 and 4. Okay, and during the exam, writing down the 5 key steps on the note paper provided in the exam will prompt you to cover all 3 domains regardless of your nerves. Interpersonal skills will be demonstrated throughout the 10 minutes. Each step together with interpersonal skill will be expanded in the next session. So it is important to verbalize what you are thinking in the exam. You cannot obtain marks for unspoken thoughts. For example, if you are concerned about a patient's safety at home, or are unsure if they understand what is being said. Similarly, if you offer to give written information, you will only gain marks if you have explained the content of written material. Okay. So let them know what you are going to write in that written information. Okay, so basic consultation structure. This section expands on the 5 key steps outlined in the previous section. Number 1, initial open question. Hello, my name is Dr. Sindhu. What brings you here today? Then actively listen. Make eye contact, gently smile and note whilst listening. Okay. And the actor will volunteer a set amount of information. In some cases, this will purposely not be very much. Follow up with a second open question you already have up your sleeve. Could you tell me more about your condition or it? Okay. Very occasionally a third open question will be needed. Try how did it all begin? Okay, so initial open questions, these 3 simple open questions can be lifesavers during the CSA. What brings you here today? Can you tell me more about it? And how did it all begin? Okay, then targeted history with red flags and examination. So try to cover all the main headings in the table below for each case. Often most of the information will already be covered in the patient summary sheet. However, it is possible that not all relevant information will be given, reflecting real life. So targeted history, ask about presenting complaint like what do you mean by migraine? If patient says I have migraine, okay, or I have tumor, so ask him what do you mean by tumor? And history, have you ever had this before? Have you already tried anything? Was there anything in particular that made you to come to see a doctor now? And past medical history, family history and drug history. Ask about drug concurrence and over-the-counter drugs and herbal remedies. And then targeted history, social history, homework and relationships, who lives at home, and smoking, alcohol, recreational drugs, and driving. So ask questions about who lives at home, how are things at work or outside work, has anything happened at home or work. And ask about red flags like if there is any weight loss, any bleeding per oral, per vaginal, per rectal or genitourinary. And ask about pain, chest or bone pains. During the exam, red flags are specific to the condition, but a simple rule is to ask about weight loss, bleeding and pain. Examine for red flags and specific signs only if case requires. Now, eyes and effect on life. There are 4 main questions: eyes and effect on life. It is important to ask these questions using a warm and caring tone of voice. It can be especially useful to ask a question slowly, even hesitantly, thus demonstrating your concern and sensitivity to the patient. So ideas, concern, expectations. Ask, do you have any idea what is causing this? Is there anything in particular that you are concerned about? Is there anything in particular you are hoping I could do for you today? And then effect on life. How does this affect your day-to-day life? Or does it stop you from doing anything? Or an alternative is how you are coping with this or finding it all. So for most cases, it is important to ensure that all these 4 questions are asked at some point. When to ask which question will vary depending upon the presenting complaint. You may find that you prefer to ask about eyes much earlier on, immediately after your initial open questions, and many candidates find this a useful way to collect a history and get to the number of the consultation. This is especially true for psychiatric and social type cases, but also true for many physical health symptoms. Eyes can also be used if you are stuck, what to do if your mind goes blank. And at this point, it can also be useful to summarize the history to the patient, and this not only shows that you have been actively listening, but ensures you have not missed anything out and gives the patient a chance to correct any wrong information. And number 4, explain diagnosis and share management plan. This step is one of the most difficult part of the CSA. The approach will vary depending on the type of case, but there are some suggested guidelines. Specific pointers are given within each case in section 2 and 3 of this book. So use jargon-free language. Try to use the same words as the patient if possible. The specific cases in section 2 and 3 provide advice on this, and practicing with a non-medic is also useful here. Because to non-medic person, you'll have to explain in a simple language. Rather saying abdomen, used to say tummy. Tell the patient your diagnosis, or tell them of the possible diagnosis, or simply your understanding of their situation. Check the understanding of this, and that is their ideas, and give management options. Often there will be more than one option, but sometimes it will be necessary to recommend urgent management. If the patient has red flags, give a rationale for investigation and treatments where appropriate, especially if urgent management is needed. Involve the patient in the shared management plan. Address the patient's ideas, concerns, and expectations, as well as the effect on the patient's day-to-day life. Ask the patient what they think of the diagnosis and management plan. Check the patient's understanding. Example, do they already have an idea of what the treatment options are? If you are unsure if the patient has properly understood you, you can politely ask them to repeat the management plan back to you, just so I can check you have correctly understood the plan going forward. And if you are breaking bad news, so make sure they are getting you. And it is discussed in section 2, so we'll talk about that later. And possible investigations, these can generally be divided in 3 areas: bedside, blood, and imaging. So bedside, like urine dip and milk culture and sensitivity, infection, swab, sputum, blood tests like full blood count and urine, electrolytes, imaging like chest X-ray, ultrasound, ECG. Management options, these can generally be divided into 3 areas: conservative, medical, and surgical, for example. And conservative is specific, social and lifestyle, specific like physiotherapy and relaxation exercises and psychology, social like inform and DVLA and sick note, and lifestyle like weight loss, smoking cessation, alcohol reduction, healthy diet and exercise, medical like analgesia, PPI, antihypertensives, surgical like joint injections, minor and major surgeries. Throughout the cases in this book, the various investigations listed are merely suggested investigations, and the appropriateness of the for which investigation to use or whether to investigate at all are all specific to the individual case. So safety net and arrange follow-up. Tell patient when to seek help, like if not improving in 4 to 6 weeks, if concerned, if worsening despite treatment, or if specific red flag symptoms develop. Arrange follow-up either with yourself or another healthcare professional like nurse or specialist, and explain how to seek further assistance if required, like if it is a Friday evening, ensuring they know how to contact the out of hour service over the weekend if concerns arise, or inform them if certain red flags appear they should go to the nearest accident emergency department, refer if appropriate. Okay, so these were all 5. Now consultation structure and summary. The 5 key steps which we discussed above, like initial open question, targeted history with red flags, and address concern, expectations and effect on day-to-day life, and explain diagnosis and shared management plan, and safety net and arrange follow-up. So now get data gathering. When data gathering introduce, open questions. What brings you here today? Can you tell me more about your condition, and how did it all begin? And then a targeted history about the presenting complaint. What do you mean by X, whatever patient is telling you? Have you ever had this before? Have you already tried anything? Was there anything in particular that made you come to see a doctor now rather than before? And ask about past medical, family history, drug history, drug convents, and OTC, over-the-counter drugs and herbal remedies, and social history, home, job, relationships, who lives at home, how are things at work, outside work, has anything happened at home. Ask about smoking, alcohol and drugs, about the red flags like if there is any bleeding, pain, weight loss, examination if required, and targeted examination if required, and then interpersonal skills, eyes and effect on daily life. Do you have any idea what is causing this? Is there anything in particular that you are concerned about? Is there anything in particular you were hoping I could do for you today? How does this affect your day-to-day life? And does it stop you from doing anything? How are you coping with it all? And summarize history. And explain diagnosis. Then now let's come to the management part. Suggested investigation like urine, blood imaging if required, and management option like conservative, medical, surgical, lifestyle, social, and then